Welcome back to everyone in our audience. Great to have you back with us. It's my pleasure and my honor to welcome Jeffrey White, DBA. He is the Academic Director for Health Informatics at the University of Denver. Jeffrey, welcome.
Thanks, Mark, for having me.
Absolutely. It's great to have you here. Before we begin, before we plunge into our topic, let me just have you share a little bit about yourself and your role for our audience.
Of course, thanks, Mark. So my name is Jeff Whitey. I am the academic director over at the University of Denver, the Health Informatics Department. I also have been in various roles in healthcare, both in leadership and data projects for about 15 years now. And in that time, I've worked with various groups, whether it's been community health centers, safety net hospitals, community public health entities, or even the Air Force Medical Operations Agency.
Wonderful. What a tremendous background. That's great for our discussion. So we are going to plunge into talking about issues around data governance, the integration of data within healthcare, forecasting, and the intriguing topic of improving care without removing the human element. So let's start with data governance for healthcare. This is a subject that is endlessly fascinating to me. And I think that many think they know what governance is and perhaps don't fully understand the complexity of it. Jeffrey, tell us about some of the gaps in understanding around data governance and in implementing good data governance in healthcare from your perspective.
Of course, Mark. So one of the things that I've seen both with my experience and also what we teach with our program is that governance is a lot more than just policy. A lot of people get kind of stuck in that. It's that overall larger data strategy and how you're going to use it, how you're going to interface with everybody. So a lot of times what we see with the gap is people see I'm just managing my HIPAA security resources, or I'm storing data in a system in a certain way, or those kind of things. They then don't really think forward on how are people going to be interfacing with it? Are they pulling data straight from a raw data table? Are they using more of a managed system like a data lakes or more functional data cloud? So the key thing with data governance is going beyond just the policy of what the data is doing and how you're going to safeguard it, but it gets into that end user interface and how you're going to go basically full life cycle on your data to make sure that everybody in the steps are kind of taken care of.
Absolutely. And if I may say, I'll just make a comment and then we'll plunge deeper into the subject. But I think based on something that you just said now, it triggered something for me, which is so often people, when they say data governance, they think that they're doing it, but they're really just focused on policy and compliance, right? At a very basic level sometimes too, like, oh, are we doing the HIPAA compliant things? Okay, we're doing the HIPAA compliant things, check. Whereas robust data governance is really about the entire way in which you look at, organize, use, share, store, everything data, right?
Correct.
Want to share about that a little bit?
Yeah, and I think that's the big thing too is I give an analogy to people that I coach and students about kind of think of a box of Legos that you buy your kid or even maybe yourself, and it's got that design of whatever it may be. It could be a Star Wars Millennium Falcon, it could be a building where it's like the Eiffel Tower or something. Like, you have all these pieces in there. When you dump out all those Legos on the floor, you just don't sort them out like we typically do with data. It's like, okay, we've got this here and we've got this here. We have a larger blueprint. We have a larger understanding of what needs to go where and why. You don't start at the top and work down. Typically, you work from bottom up. So there's all these concepts of how do you make sure that those things are working the right way when building. Same thing with data sets. What I often work with folks is knowing your inputs and your outputs first, kind of like a SIPOC diagram, and knowing what your supply and consumers for the data are, and then working your way in to know how to build the system inside. So when I was working with a community health center, that's what we end up doing was we knew all the data that we had access to, but we also knew all the data that needed to go out. But we took time, we took almost 2 months of inventorying every stakeholder that was consuming the data, whether it was patients, whether it was our individual staff, grant management groups and foundations, the federal government, because they were a community health center and working with an FQHC model. There's all these different groups that were consuming the data. So we had to understand what all the data they needed was and what the data we were getting, and then what was in the middle. How did we have to sort it, prep it, organize it in a way that then it was easily retrievable. So
Exactly. Tell me, Jeffrey, just briefly, what are the biggest mistakes you're seeing among the organizations that are making mistakes? No names, of course. And the ones that are really A+ in data governance, what are they doing right? So what are people doing most wrong and what are people doing most right now?
I think the very first component within a good data governance or data strategy is your stakeholder management. Similar to any kind of project or program management, is really understanding who is involved and how, and getting their input. So the real key thing in there is making sure everybody's brought to the table. Like I was saying, is you're going to have insurance companies that will need data for claims data so you can get paid. So they need certain elements, but you're also going to have patients needing information from their patient visit that's not the same as claims data. So understanding how everybody ingests the data differently from the beginning and getting their input on, is the reports, dashboards, data structures that they're receiving, are they in ways that are usable to them? So even like currently right now, I'm working with a contract with the state of Colorado for COVID response, and giving information over to the public health department. You have to be able to ensure that they're getting the data the way they need it. So I go through multiple iterations, almost like an agile sprint cycle of saying, is this how you need it? If not, I go back in, do my alterations, make sure it's good for that gate check before we go on to the next piece of the project. So
Yeah, absolutely. And that segues naturally into, I know you wanted to talk about the topic of the larger integration of data within healthcare. Let me just say, one of the things to me that has struck me for many years now is that there are so many incredibly smart people in the healthcare, yet the healthcare system is so disjointed on so many levels. So you've got really smart people taking tiny pieces of things, right, and trying to work with them. It's like 30 people trying to knit a sweater, right, at the same time. And one says, well, I'll do the cuff. Well, you can't knit a sweater that way. How does this fit into that larger integration issue? What are the issues there?
of course, so once you get your data governance sorted out, it helps you with that integration piece. Because like you're saying is, you see the old time photos of you had a few individuals working on a quilt or something, and you see them all working on pieces. They're not doing their own thing. Well, they may all have their element and they know what they're working on, but there's someone that gave them a larger plan. How do you know what the quilt looks like when it's done? Same thing with data is, when we think of it and the larger almost system of things and that big data concept is, how do we know that things are constructed in a way that are made to help support the organization long term?
Right.
And not just the organization, but also the partners of the organization, the consumers, the clients, all those different elements. And I think that's the big thing when you look at that integration is, you're going to have finance data, you're going to have patient visit information, you're going to have patient experience data, your supply data, you're going to have all these different things going into the system. And if you're just randomly throwing things in there and hoping to pull stuff one in and out at a time, you're losing that synergy. And I think, as you were talking about, you've got all these different people that are very brilliant, but we teach people in healthcare, I think, very specific tracks. And then some people may learn outside of their track and do that. But like medical providers mainly focus on medicine, and they focus on how to care for the patient. They're not thinking of finance and all those different things. So what I really strive for with this is, with our systems design type concepts, is how do we get those leaders at the top level to think of the larger system? Because your consumers, your staff, all these different elements are not thinking of it in every bucket. So it takes that top level leadership to help bridge those gaps to make sure it's integrated.
And I'd like to go to a place that I think will be a sweet spot for you on this. I know that you are trained and in fact, you lecture on um, performance improvement methodologies. One of the things to support what you just said, there has historically been a lack of systemic thinking in healthcare, right? I'm going to bring in another analogy, the great parable of the 6 blind men and the elephant in India, right? The king had 6 blind advisors. I'm not sure why he had 6 blind advisors, but anyway, we'll go. And, each touched the elephant, and, one touched the trunk and one touched the foot and one touched the tusk and all that. And so they all thought it was a different creature. The point of that being, so often in healthcare, we're almost working at cross purposes because tiny teams of people are just doing all different things and they're not organized. What has your work, your study of and your work in performance improvement methodologies taught you or enlightened you on regarding how we have to make all the data processes work together and integrate and not just be a million different little pieces?
So that's actually a good point. So that comic of the king's advisors touching the elephant, I actually use in some of my systems design lectures. And it's a great concept because of the fact that technically none of them are truly wrong on what
Right.
they are perceiving.
Yeah.
And I think that's something that we also have to be mindful of is I always talk to folks about the concept of good intent. It's something I learned when I was studying lean and Toyota production systems is people don't come in to sabotage typically your work, and people want to be respected. So when I think of it that way in terms of the integration of systems is everybody has an expertise. People are perceiving what they need. So then you're moving into that larger system dynamic. So the 5th discipline was a classic book about systems thinking that I use for some of my courses and coaching. And it really touches in on the fact that the way you get into that 5th discipline is by inclusion, but then also that ability to listen to everyone and helping guide. And I think that's the key thing, especially when you start looking at project and program managers, CIOs, CTOs, all these different roles, is them having the ability to step outside of just what's in their line and looking at the larger picture of how to bring everybody together and how it can benefit everyone.
Yeah, exactly. I think one of the things that I found to be so challenging in healthcare is, again, it goes back to super smart people in all disciplines, but a lack of coordination. In learning about and teaching about lean and TPS, I'm sure one of the key things that has impressed you, and I'd love to have you just speak to it for just a second here, is the idea that everything actually is connected. Yeah. And we have to map out our processes. And in data governance, that's such a huge issue, right? That it can't just be, the group in this one little room, they're just going to keep doing their own thing. Everything has to somehow be connected, and people have to be thinking at that higher kind of meta level. What are we trying to do with our data? Can you just expound on that for a second?
Yeah, so one of the examples I use when I work with like boards and executive teams is thinking of it almost like healthcare professionals. You might have people that are general practice providers, and they understand the larger system. And that's what I always try to fancy myself with when I go to help organizations or in my roles, is really helping people understand the full system, because you may have those specialists that come in and know some other piece much better than I do. And I rely on them for what they do, such as I wouldn't know, if I was a general practice provider, all the inner workings of the kidney function. That's why we have nephrology.
Yeah. And
the nephrologist specializes in that. But when it gets into the rest of the urinary tract and other elements there, they get into urology. And those are going to tie into hematology because the blood filters through kidneys and that kind of stuff. So all these specialists specialize in their area, but they need to work together in order to do that full comprehensive health system for that patient. Same thing with data is we may have someone that's a finance expert, and they have to be able to talk about that finance element and how it works with their medical counterparts, with their operational counterparts, with their support and supply and all those other counterparts. So they are a huge member of it. But what happens is, because again, they're so specialized, they're so used to that function, they sometimes don't think of the larger system. So what I've often recommended to people is figuring out who that larger system thinker is, who your general practice provider is that can help coordinate the specialist. Because when you have someone with huge chronic conditions, the person that is overseeing the continuum of their care is not going to be the same one that specializes in specifically their diabetic care or specializing specifically in their eye care.
Yeah.
So,
And how, let me just ask one question about how some of the people listening to this or viewing this will be like, well, this is all great, but it's expensive. How do we talk about paying for this, and how do we talk about the idea that we need to invest to some extent in systematization?
so what I typically recommend to folks is, I'm a person that I get it. I've worked in FQHCs and nonprofits for many, many years. And even when I was doing government work, trying to get appropriations for positions, it's hard to get things that are not revenue generating approved,
Yeah.
especially when they're very expensive. So what I recommend to folks is, if you're actually wanting to really invest into this, is to really start to determine, how do you maybe create cross-functional teams. At the community health center that I was at, I took that on as part of my job description, even though I mainly was focusing on compliance and other work. Strategy was an add-on to me because I had so many touch points in every other function because of my other roles of compliance and training and project management. So they added it there. So sometimes it can be an additional role where it's oversight, and then you have the help of a matrixed committee to help kind of work those kind of elements. Some organizations can actually afford someone to do that. Sometimes I also recommend actually get a senior leader, whether it's a mid-level director and a lower level executive, whatever it may be, getting them experience into that, some kind of a training or coaching into it, so that way they can manage it. What I found was, it's very difficult to always pay for consultants or outside people to manage things. And it also gets very expensive if you're bringing in whole brand new teams for stuff, especially if you're not designed there. Sometimes you'll need to bring it in temporarily to help build. And that's usually what I recommend is, maybe you might need an outside group to help you jumpstart it quicker, because trying to do it yourself might be a little bit painstaking, especially if you have no one with experience.
Right.
But on the flip side is, I get it. I've been with nonprofits, and it's so hard to say, I'm going to just hire someone just to do this. So then it's a question of repurposing. We all probably have change fatigue from organizational changes over the years, but there is purpose to them. And especially when you start to implement strategies like this, because even though we had a data manager at the community health center I was at, he didn't take on the full data governance / strategy of it, because his bandwidth was too limited, because he was actually going to be implementing the new SQL servers and all this other stuff that required a lot more hands-on touch. Me being compliance and already being the HIPAA privacy officer, I had that oversight, and I was able to merge my role and partner with him to do stuff. So
Right.
I think it's fluid. I think a lot of times people try to prescribe, no, you need a role of this, or you need this person on this. I think that's where that critical thinking piece comes in for leadership, of saying, where does it best fit in our organization?
Right. Absolutely. And as you said, I mean, sometimes we need to bring someone in to teach us how to fish, right?
Yes.
And then we have to keep fishing. Let's talk about forecasting. I know you wanted to talk a little bit about how just where forecasting fits into this landscape that we're describing right now.
Yeah. So knowing your data and knowing the past helps inform your future. So that's the big thing I really push on. That we hear all these advancements with artificial intelligence and AI, machine learning. automated algorithms, data clouds, all this kind of stuff. All that is great things to have, but it's also the concept of understanding how it's been used in the past and what you're pulling from to make sure that it's accurate modeling. So that's the first thing. The second piece I pull out of it is if you look at like the hurricane projections, like with Weather Channel or your local meteorologist when it comes to any kind of forecasting, it's not just one model that they ever use. It's dozens, if not hundreds of models that they map out every possible issue that could come up that could alter the wind pattern by this much or alter the moisture and humidity this much or barometric pressures. All these different factors change. Same thing with healthcare. What happens if we don't hit our 5% growth goal for patients? What happens if we don't get the new surgical center built by the end of 2022 and it's now 3 months delayed? I mean, think about the VA hospital. I'm here in Denver, about the many year delay that had. All those kind of models, when you think about it, you should never just have one, you should have many, and then you should make that determination of what's your most likely projection. Same thing like what they do with hurricane paths is, if you ever look, there's like 50 different models and you see them spreading all over the place, but you see the majority of them hit one kind of cone, and that's how the cones are made. Same thing with what I see with data modeling within healthcare is, here's a 0% projection of growth. Here's 10% projection of growth. Here's maybe the 5, which is most likely, which is what we're planning on in our budgets for the year. So,
yeah, very important. Thank you for that. I know you wanted to also talk about improving care without removing the human element. And that's a tremendously compelling and intriguing topic for me. What would you like to say about that?
so like I was saying earlier, my background, especially with a lot of the project and process improvement work, was within Lean and Toyota production systems. I used to work actually at the Denver Health Lean Academy as one of the faculty there, and being a facilitator and project manager out of there. So I spent a lot of time researching process improvement through Lean, and there are two pillars when you look at the Lean model and the Toyota production model is continuous improvement is one, but respect for people is the other. And I think that's a key thing whenever we look at innovation in healthcare, because if we lose sight of the person, whether that's staff, whether that's the patient, a consumer, our vendors, our partners, anybody, we start to sacrifice what's going to happen. So that's the first element in there is when you make things difficult on folks, they will find a way around it. So that's one element with data is if we make it difficult on our staff, we make it difficult on our patients, our partners, they'll find a way around it or they'll just stop utilizing it, which is unfortunate. So that's one piece. I think the other piece of it too, with the respect for people, is operating at a top of license. So I always talk about this, especially in a clinical sense, but it works for everybody. We talk about it a lot of times with providers working at the top of their license, or nurses or technicians or anything like that. You don't want your provider to do scribe work. Yet how many times, especially with EHRs, do we have them doing that type of work because of how the systems are set up with who can approve what and those kind of things. So there's a lot of elements of thinking about the respect for person, especially in what they're responsible to do and what their level of responsibility should be. The thing I often frame that around is think about it like standing orders within healthcare. When we set up standing orders, it's because providers have trained and entrusted their staff, their nurses, their MAs, or whoever it may be, to be able to do certain things without them present. And I think it's the same thing when it comes to big data and your data governance models, is being able to entrust people to do different things. Like you were talking about, it's very expensive to set up a huge data team to manage things or to outsource it to an AWS or someone else to do it for you. So if you do that and you're entrusting people, but then you have to be able to make it in a way that they can do it to their competency. So if you're having your clinical manager pulling stats and other information for your provider team, they have to be able to know to do it, and you have to give it to them in a way that is not requiring them to work so far out of their scope of practice.
And I think that also speaks to, in a way, it goes back to what we were talking about in terms of lean and TPS, right? Because one of the core elements in the improvement methodologies is the idea of helping all members of a team or an organization to be working appropriately relative to what their capabilities and skills are, right?
Right. That's exactly it. And that's the thing too. And that's where you get, like I said, really into that respect of humans. One of the funny things is, so I actually lived out in Texas for a while, was a few minutes away from a Toyota plant down there. The military group I was with at the time went down and gave them a tour, and the individual giving the tour at Toyota actually gave a really cool example where they actually had representatives from Ford touring their facility. You would think that's kind of weird having your competitor tour it. And they were touring around and they were making comments about, hey, I saw that that person's pulling the end-on cords. They're little like, hey, I have an issue over here thing. And then he's like, yeah, I see another one doing over there. I see another one doing over there. He's like, you've got like 50 stations here, and I already seen 3 people pull the cord.
Yeah.
And the Toyota person was like, yeah, because we want to know where the issues are so we can fix it for them. That gets into the respect for persons too, especially with data. Is many times with data governance is it's policy and this is how it works, instead of listening to the stakeholders in the end as well. So that's another big piece about not removing the human element, is you should automate to a point that allows people to effectively do their jobs that require repetition, but without losing their critical thinking ability.
Right. Well, and that also speaks to ultimately this whole mantra that is very true: people, process, and technology, right? Can you just speak to that? Because I think it's so important for people to understand how we talk about technology, but ultimately we're really talking about people, right?
Right. It's an analogy that we would use when we would teach at the Denver Health Lean Academy was, if you put a motor on a broken bicycle, it's still a broken bicycle. The same thing with technology is, we can go say, hey, we're going to go invest in Azure or AWS or Google Cloud or whatever it may be to help do all this big data stuff for us. But if your processes aren't right, if your data governance isn't right, then you're still in the same boat. You've just put a very fancy engine on top of something already broken. And I think that's the big thing too, is you have to understand the people's needs. You have to understand your processes, because the technology, all that does is help streamline it quicker. The same thing we do with Google and stuff, we would have to go back in the day to a library and pull out books and articles and that kind of stuff, in a physical setting. Google has got us to a point where we can pull that stuff much quicker, or electronic libraries. So all technology does is what we used to do in some fashion quicker. Even Steve Jobs used to joke about when he developed the iPhone, he didn't make anything new. He just integrated things together to work better. There was already cameras developed. There was already music players developed. There was already phones developed. But people didn't want to carry them separately. People wanted synergies between their programs. People wanted the ability to carry one device. That's where this integration and this data governance comes from.
I'm so glad you mentioned Steve Jobs, because even though he was a tyrant, he also demanded that every product produced by Apple be consumer friendly, even consumer loving, right?
Right.
People love their iPhones. I have two, because they are so form friendly. They're so friendly to their users. You like using your iPhone, right?
Right.
My very first smartphone was something that doesn't even exist anymore. It only existed for a couple of years because it was so bad. That was my first one. And so I think it's interesting, because when we pull all these elements together and people are operating and working in wonderful multidisciplinary teams that are working on the same objectives and everyone understands what's going on, you create the equivalent of an iPhone in your organization, right? That's where you can go with managing your data. So I really appreciate this. Can you leave us, we're about to conclude, but can you leave our audience with just a couple of pieces of basic advice relative to everything that we've been discussing, things that they should think about as they move forward in their journey.
Yeah. And like I said, kind of at the beginning, is my number one foundational building block to any kind of data element is that stakeholder piece. Like we were talking about with the iPhone and all these other examples, is when you know who's going to be consuming it and you know how it's going to be used, it better informs your design. It better informs how the inner workings will happen, the infrastructure. So that's the first piece. The second one is making sure all voices are listened to and you respect all individuals involved in the process. It's very key. I know many times when we did projects, we would bring in patients for the patient voice. We bring in not just providers, but we bring in MAs, we bring in front desk, we bring in supply techs, we bring in all these different folks because we wanted everyone's voice. So that's the second big thing, is that respect for person, listening to everybody. And the last one is, I think you and I had joked about this before, Mark, is like with weather forecasting, they joke around, it's an imperfect science and an art. Data science is the same way. There's a lot of technology and a lot of mathematics and all these different things behind it. But in the end is, we don't know the future. All we're doing is we're trying to project based on what we know in the past. And our understanding of the past is limited.
Right.
So it's always that concept of being mindful of, no matter how good your governance is, no matter how good you are with working with stakeholders, there is going to be some things that you can't foresee. Like nobody really saw 2 years ago where we'd be at today with COVID, right? And it's those kind of things, is there's going to be imperfections to the science. So it's continually learning, continually building, continually listening.
Absolutely. And the teensy bit that I know about hurricane forecasting, based just on watching a few documentaries, so believe me, I'm no expert. The models, as you mentioned, models are based on past behavior and circumstances, right? So to the extent that the meteorologists try to tell us where a hurricane is headed, those models are statistical and mathematical, and they're based on where hurricanes headed before. And we've had situations where it was very surprising what happened, like Hurricane Sandy, for example.
Right.
Really surprised everyone where it hit and how it hit and all that. So we're just trying to move forward with the continually improving yet still imperfect sets of tools that we have, right?
Exactly.
Exactly.
And it's the same thing like with even healthcare, is we know kind of standards in terms of how a body functions based on tests and those kind of things, but we're still learning things every day. Genetics is showing us many things that we didn't know 10 years ago. And I think it's the same thing as well with data sciences. Like you said, with the hurricane modeling, it's based on what we know. We model based on what we've learned, and we'll continue to learn, which will refine the models more.
Right. Absolutely. Well, Dr. Jeffrey Whitey, I appreciate it tremendously. We've learned so much. I know I have. Thank you so much for spending time with our audience today.
Of course, Mark, take care.
Great. Thank you. This concludes the session. Thank you to you and our audience for participating. Thank you. Have a great day.